Hello, my name is Stephen Marr. Today I'm joined by Kyle Lighthizer, and what we're going to do today is show you the appropriate way to administer the FAST ED assessment for an individual with stroke-like symptoms. As we move through this assessment, what we're looking for is different scoring and how it applies to the FAST ED mnemonic. So the first thing that we're going to do in our assessment is gauge facial palsy. So with this, what I would do is ask the individual, "Sir, what I'd like you to do for me today is go ahead and give me a big smile. Let me see your teeth." Now this is a scoring of either 0 or 1, with 0 being no deficits, and what I do note is I do have some paralysis on that left side, and I'm looking for symmetrical rise and no facial droop, which I do have on that left side. The next assessment that I'm going to do would be arm weakness. This is navigated by asking the patient to please raise their arms up, close their eyes, and go ahead and just keep your arms up for me for at least 10 seconds. And then I let go. And what I note here is I have a partial arm drift on the left side, and this is scored through a 0, 1, and 2, either no deficits, partial, or complete arm drift. Next, we move into speech. We navigate this assessment by asking the individual, "Sir, I need you to repeat after me. You can't teach an old dog new tricks." Can you say that for me?
You can't teach an old dog new tricks.
So again, I'm looking for any deficits here, either none, partial, or complete severe aphasia. Next, we move into T, our timing. Now the timing doesn't play a direct role in our scoring system, but what it does allow us to do is to look at whether or not we are navigating towards a primary stroke facility or a comprehensive stroke facility. It also lets us know if we're within the window of our total stroke alert criteria. So it plays a critical role. So with this, what I would do is I'm trying to gather the exact time that symptoms were onset was noted. And if I can't get an exact time, then at least the last time the patient was seen normal. I want to be as specific as possible here. So even down to the hour and the minutes. And I also want to document whether this happened while the patient was awake or whether or not it happened to him while he woke up from his sleep. And then also of importance is gathering name and phone number of any witnesses on scene so I can relay that to the hospital for further documentation completion and follow-up. This trends us towards the end of our assessment, and this is going to be eyes for eye deviation. So with this assessment, I'm going to ask the individual, "Sir, can you just follow my finger back and forth?" And I do this a couple times, and again, no deficits, partial, or complete fixed gaze up to one side. And then finally, we get to denial or neglect. With this, I'm looking for tactile stimulus on both sides, so I'm going to tell the individual, "Sir, can you feel me touching you on either side?"
I feel you on my right side.
This lets me know that he has deficits and maybe some denial on his left side. I can take this a step further and kind of hold his arm in his hand and say, "Sir, can you feel me touching this? Do you recognize that this is your arm?"
That is your arm, sir.
Okay. So this again trends me towards a scoring of 0, 1, and 2. As always, anytime completing a FAST ED assessment, although it's not built into the mnemonic, go ahead and make sure you get a glucose, as many hypoglycemic patients can present with stroke-like symptoms. All of that scoring that we did goes ahead and plays a role in our hospital destination, and for a complete review, be sure to look over M4 of your MOMS or the CT10 of your clinical tools. Thank you.